Well, this month, the World Health Organization dropped some staggering information from a study done by the International Agency for Research on Cancer. Now, the study said that there is a huge yearly spike in cancer worldwide. Here to talk to us about this very important issue is Dr. John Iacuone, Chief Medical Director, or Medical Officer for Lovelace Hospitals. Doctor, thanks for coming in.
Oh, my pleasure.
First of all, these numbers are pretty scary. We do have some, I want to show you a graphic that we made with showing the study. Basically, in 2008, there were 12.7 million new cases of cancer reported worldwide. In 2012, the following year, 14.1 million. And then in 2025, there's a projection that there will be 19.3 million cases. Doctor, what do you think is causing this increase?
Well, I think there's three main things. One, the population is growing around the globe, so the more people you have, the more cancer you're going to have. The other thing is people are living longer. And the longer you live, the more likely you are to have cancer. If you, it's predicted that up to 75 years of age, there'll be 1 in 5 men and 1 in 6 women will have cancer.
Wow.
They may not die from it, but they will get cancer. That's staggering. That's like 20%. So you couple people living longer and more people. And then the third thing is people are aggregating from rural settings all over the world as the third world is becoming more industrialized into big cities. And there's epidemiologic data that shows if you're crowded in a big city area, more pollution, more toxins in the air, more viruses, more things, and those trigger and contribute to cancer. So it's inevitable as we gather closer together, grow into population and live longer, that those rates of cancer will go up.
You know, taking a closer look at the most frequently diagnosed cancers in this study, lung cancer apparently the highest at 1.8 million new cases annually, breast cancer the second with 1.7 million new cases, and colon cancer coming in third at 1.4 million cases. Dr. Iacuone, what do you think we should be doing, or what can we do in our daily lives to try and decrease these numbers or try and prevent them?
Absolutely. I think, you know, clearly the odds of getting cancer as we grow older are higher. So what can we do to mitigate that? Prevention is obviously healthy eating. We talked about that earlier on the food bank segment with vegetables and nutrients, fresh foods. Exercise, obviously smoking is a massive contributor to lung cancer. In women, amazingly, alcohol intake is associated with breast cancer.
That is interesting.
And in colon cancer, you know, we recommend screening, but I can tell you, a lot of people really, there's so many screenings available, mammograms, the colonoscopies, and you know, and stop smoking. So there are things we can do to reduce or eliminate our risk for getting cancer as we grow older. But I think the main thing is to, and we cure so much cancer now that if you get colon cancer and you find it early you can be cured of that. So knowing the odds are going up that you're going to get cancer, the key is let's get those screenings, let's get those mammograms, let's do healthy lifestyle changes, reduce our alcohol intake, stop smoking, get our screens that are out there to prevent cancer in a timely fashion.
Stay on track with your health folks.
Absolutely.
That is the bottom line. I think mammograms, they recommend at the age of 40 for women, or men for that matter, and for colonoscopies, is it 50 for men mostly?
And they have, you know, your doctor will guide you as to how frequent that should be.
Dr. Iacuone, thank you so much for coming in, shedding light on this. Hope you have a wonderful weekend and holiday with your family. I know you got a couple of them.
Yeah.
All right, stay right there, folks. 8:49 is the time. We'll be right back.